Today we're going to talk about HIE. So what is HIE? HIE, or Health Information Exchange, is the process of electronically exchanging patient information between various hospitals and providers. While it is still gaining ground, HIE is extremely beneficial. HIE helps improve quality of care and increases patient safety by reducing medication and other medical errors. It also increases efficiency and decreases costs by eliminating unnecessary paperwork and redundant testing and lab work. HIE also makes public monitoring and reporting easier. The main goal of HIE is to grow the patient's medical record and then be able to allow providers of all kinds to have access to the patient's record. This replaces the old and sometimes current way of patients carrying a paper record copy of their chart from provider to provider, or worse, not providing any previous medical records to providers. This electronic information exchange creates a more complete medical record for the patient and allows for more continuous care. There are three types of exchange involved with HIE: directed exchange, query-based exchange, and consumer-mediated exchange. Directed exchange is the ability to send and receive patient information between providers, as in the case of a primary care physician sending patient information to a referred specialist. Query-based exchange is the ability for providers to search for certain patients in the database. This usually is in the case of unplanned care, like an emergency room visit. Consumer-mediated exchange is the ability of patients to combine and control the use of the medical information among their providers. This type of exchange has been compared to online banking and allows the patient control of their health record. With this control, patients can correct any errors and missing health information and monitor their own health easily. As DMPs, it's our duty to inform patients and other care providers about HIE and its benefits. As care providers that are also consumers of research, DMPs are in a unique position to help influence not only practice, but legislation and policy as well. We must advocate for our patients and the completeness of the medical records. DMPs must also actively work with the legislature to increase the use of HIE. Federal legislation on HIE can be traced back to the HITECH Act of 2009. This act laid the foundation for encouraged EHR use in all care areas. This act also is the first to describe protected health information in an electronic format and to describe private and secure health information exchange. Most recently, the 21st Century Cures Act of 2016 created a framework for HIE use. This act also defines interoperability, or the ability to easily exchange electronic patient information without special effort by the user. This definition also says that authorized users will have complete access, exchange, and use of all electronically transmitted information. The Act also clarified HIPAA in relation to HIE. After the creation of the HITECH Act of 2009, the state of North Carolina created the North Carolina Health Information Exchange Authority, or NCHIEA, in 2015. This organization manages NC Health Connects, a secure online HIE portal. Currently, state law is requiring hospital-based providers that provide services to Medicaid patients to upload information to NC Health Connects by June of 2018. All other Medicaid providers must begin uploading patient information in June of 2019. While this is progressive, there are still gaps in the legal obligations of healthcare providers in relation to HIE. To move forward with HIE in the state of North Carolina, education needs to happen. Many patients and some providers are unaware that NC Health Connects exists. I was unaware until I started researching for this project. In order to move forward, patients will need to be educated about the system, its benefits, and their rights and options. North Carolina government also needs to work on linking the NC Health Connect system with nationwide systems. With several colleges and military bases in the state, many patients will move across state lines. Without the ability to exchange information with out-of-state providers, patients will not see the true benefit of HIE.